Imagine a pregnancy that starts normally, but instead of reaching the safety of the uterus, it implants in the wrong place, silently growing in a tube that was never meant to stretch. That is ectopic pregnancy, a medical emergency where a fertilized ovum implants outside the uterine cavity, most commonly in the fallopian tube. It may initially look like a normal early pregnancy, but the danger is hidden. As the embryo grows, it begins to threaten the life of the mother due to risk of tubal rupture and massive internal bleeding. The tragic part is that the fetus cannot survive, and delay in diagnosis can cost the mother her life. This condition is one of the leading causes of first-trimester maternal death worldwide, especially when it goes unnoticed. Early identification, rapid intervention, and vigilant assessment by healthcare professionals are life-saving. The classic triad of ectopic pregnancy is abdominal pain, amenorrhea, and vaginal bleeding. Abdominal pain occurs as the fallopian tube stretches under pressure, leading to inflammation and irritation of surrounding tissues. Vaginal bleeding is caused by poor decidulation and instability of the implanted site, resulting in breakdown of tissue. Amenorrhea occurs because pregnancy hormones are already active, even though the implantation is not inside the uterus. As the tube begins to rupture, the pain becomes sharp, unilateral, and radiates to the shoulder due to diaphragmatic irritation from intra-abdominal bleeding. A woman may also show signs of shock such as dizziness, tachycardia, and hypotension if significant hemorrhage occurs. These symptoms are red flags for nurses and clinicians to immediately suspect ectopic pregnancy. The story begins with fertilization, which usually occurs in the ampulla of the fallopian tube. In a normal pregnancy, the zygote travels to the uterus for implantation. However, in ectopic pregnancy, something obstructs or delays its passage, such as tubal scarring, faction, adhesions, or anatomical abnormalities, causing the embryo to implant prematurely inside the tube. Because the fallopian tube lacks the thick, elastic, muscular wall of the uterus, it cannot support the growing embryo. Human chorionic gonadotropin continues to rise, but the environment is not sustainable. As trophoblastic tissue invades the delicate tubal wall, it erodes blood vessels, leading to internal bleeding and progressive distension. When the tube can no longer stretch, it ruptures, triggering life-threatening intraperitoneal hemorrhage. The priority in management is rapid diagnosis and stabilization. Transvaginal ultrasound combined with serum BTHCG levels confirms the absence of intrauterine gestation. If the ectopic pregnancy is unruptured and detected early, medical management with Methotrexate is used. Methotrexate halts the growth of rapidly dividing trophoblastic cells, allowing the body to reabsorb the pregnancy tissue naturally. However, if rupture is suspected or hemodynamic instability is present, emergency surgery becomes necessary. This may be performed via laparoscopy or laparotomy, depending on severity. In some cases, salpingostomy is done to preserve fertility, while severe damage may require salpingectomy. Hemodynamic support with IV fluids, blood transfusion, and continuous monitoring is critical. Early intervention significantly reduces maternal morbidity and mortality. Nursing care focuses on early recognition, stabilization, emotional support, and prevention of complications. The nurse must closely monitor vital signs, pain intensity, and signs of hypovolemia or shock, establishing for access, preparing for emergent surgical intervention. And ensuring cross-matched blood availability are essential in unstable patients. For patients receiving methotrexate, the nurse must educate about avoiding folic acid, alcohol, and strenuous activity while monitoring serial BTHCG levels until resolution. Psychological care is equally important because the loss is both unexpected and traumatic. Nurses provide empathetic counseling, assess anxiety and grief, and guide the patient through recovery and fertility counseling. Effective nursing vigilance can mean the difference between survival and fatal delay.